Well, there was a lot to discuss, everything from new vaccine policies, booster shots, a pause on further reopening in our province, Ontario bracing for this challenging fourth wave. Will we be ready? Bringing in the province's top doctor now, we say good morning to Chief Medical Officer of Health, Dr. Kieran Moore. Thank you for joining today.
Good morning, Melanie.
We are 3 weeks away from school. Parents, students, educators, everyone was looking for the direction. So in your news conference yesterday, it was vaccine policies, but a lot of people criticizing it, saying there was gray. There was a gray area because nothing necessarily mandated. I want to play one clip from your news conference from a couple days ago, and I'd like to get your reaction on this. So if we could get this clip here.
Ours is the bare minimum that I would expect a partner to implement in their settings that we've outlined in the directives.
Okay, Dr. Moore, a lot of people are asking questions about that term. You called it a bare minimum when it comes to the directives. Can you expand on that?
So what had happened, and that was particularly in reference to our hospital sector. Some had already put in policies to have immunization of their workers to best protect their patients. And we wanted to ensure that there was consistency across the entire province for all hospitals in Ontario to have this baseline minimum standard of show us you've been immunized and or you have a medical exemption and or we're going to give you an educational session. And if despite the educational session, you're still not immunized, we're going to suggest testing on a regular basis to protect patients. So that's the baseline minimum. Some hospitals can put in mandatory if they're not achieving the high rates of protection they need for their patients. And that they'll do a risk assessment. They'll see how well they're doing, what proportion of their workers are immunized, and they'll make decisions beyond that. So this is a baseline minimum for the acute care sector, for the home care sector in particular.
Dr. Moore, personally, would you like to see more done, more put into place in settings, high-risk settings like healthcare, like schools, where it is mandatory and not these guidelines where there is a bit of gray?
So I think it's a professional responsibility of anyone caring for patients, whether you're an environmental cleaner, a respiratory tech, a nurse, and or physician. It's a professional responsibility to be immunized to best protect your patients. I'm sorry that we have to start these policies, but these are put in place to best protect our patients. And as long as we keep a patient focus, I think we're going to be heading in the right direction. The same can be held true for school settings where we have vulnerable children that can't be immunized, so 11 and under. I think we need to have policies in place there, and we're working diligently with education to have those policies in place to best protect those vulnerable sectors. And we're going to be releasing those very, very soon. It will be compatible with our policies for the acute care sector. So please get immunized, show us you've been immunized, a medical exemption or education, and testing if you're not. That is the baseline minimum of my expectations for these sectors.
Dr. Moore, you mentioned these policies are coming out soon. When can we expect those?
We're working on them day in, day out. So with the cabinet, made the declaration for those, that direction on Tuesday to us, and we've publicly put that out. And now we're working on the fine print as we speak.
Okay. You mentioned also in that same news conference, it is going to be a difficult fall and winter, in your words. What are the projections that have you thinking that?
Well, we just know that Delta is so much more transmissible. It spreads so much more quickly from one person on average to 7 or 9 people. So it can spread very, very quickly. And we know now that it's more virulent. It puts more people in hospital and threatens their lives. And we just have to watch other provinces that are having major upticks. Their case counts are 3 or 4 times ours. Their hospitalization rates and admission rates to the intensive care unit are now going up. So, I do appreciate us being cautious, learning from elsewhere, and being slow, keeping our masks on, doing our hand hygiene, getting tested, and above all, preventing this. And we prevent it through immunization. 81.7% of Ontarians that are eligible have come forward and had their needle in arms. We need to keep up that momentum. I think our immunization counts are only going to continue to go up. I thank all Torontonians, all Ontarians that have come forward, but we can do better in the face of Delta, and we absolutely need to. Otherwise, we will see what other jurisdictions are seeing. We'll see an uptick in hospitalizations and patients in the intensive care unit. And to me, all of this is preventable. And I hence have requested this pause in moving out of step 3 so that we build up our protection at a population level, so that we give more opportunity for our workers to come forward and be immunized, especially those in education, in healthcare, working with vulnerable populations.
Dr. Moore, we have run out of time. I don't know if you can do this in about 10 seconds, but booster shots, we heard of the U.S., they're going to be available to the general population next month. Is that something that is coming to us shortly?
It is absolutely on our radar. We're working with our national colleagues who will be reviewing the science for that and are partnering with all international organizations that are making these decisions. So we look forward to working with the National Advisory Committee on Immunization on those decisions.
Okay. Dr. Kieran Moore, we appreciate you taking the time for us today. Thank you.
Thank you, Melanie.
All right, 8:11 right now. We're going right upstairs to Steph. Good morning.